Hello, everyone. My name is Pharmacist Michael, and today I'm going to talk about a subject I get a lot of questions about, and that is clonazepam. Whether you're prescribed this medication or just curious about it, we're going to cover everything you need to know, from its uses and side effects to who should take it and who should avoid it. Plus, we'll explore some natural alternatives to benzodiazepines. So let's get started. Clonazepam is also known by the brand name Klonopin, and this is a medication from the benzodiazepine class. We primarily use this to treat panic disorder, certain types of seizures, and sometimes for short-term relief of anxiety symptoms. Clonazepam works by enhancing the activity of a neurotransmitter called gamma-aminobutyric acid, or GABA. This helps calm the brain and nerves, providing relief from anxiety and also preventing seizures. Clonazepam is usually prescribed for individuals diagnosed with panic disorder or specific seizure disorders. It's important to use this medication under the guidance of a healthcare professional. Clonazepam is generally recommended for short-term use, typically not exceeding a few weeks to a few months. Long-term use can lead to dependence and other complications that we'll talk about later. Now, clonazepam is not suitable for everyone. Those with a history of substance abuse, severe liver disease, or certain types of glaucoma should avoid this medication. Pregnant or breastfeeding women should also consult their doctor before using clonazepam. Like all medications, clonazepam comes with potential side effects. Common ones include drowsiness, dizziness, fatigue, and coordination problems. More serious side effects can include depression, memory problems, and difficulty breathing. Clonazepam can also interact with other medications, including other benzodiazepines, certain antidepressants, and opiate medications, which can increase the risk of severe side effects. Always inform your healthcare provider of all medications and supplements that you are taking. Now let's compare clonazepam to other common benzodiazepines like diazepam, lorazepam, and alprazolam. Clonazepam has a longer half-life compared to alprazolam, which is Xanax, and lorazepam, which is Ativan. This means its effects last longer, making it suitable for conditions requiring sustained relief, like seizure disorders. Diazepam also has a long half-life, but clonazepam is often preferred for its potency in managing seizures. Another note about diazepam is it does have more of a euphoric effect on the person, and it's also really not very good for elderly patients. Because it's fat-soluble, it can get into the fat cells and slowly leach out, which can change blood levels over time, leading to dangerous levels in some cases, and an increased fall risk. In terms of onset or how fast it works, clonazepam takes a bit longer to take effect compared to alprazolam, which works quickly to relieve acute anxiety symptoms. But clonazepam is generally used for long-term control rather than immediate relief. Each benzodiazepine really has its specific use cases and benefits, so it's crucial to follow your healthcare provider's recommendation based on your individual needs. If you have to take clonazepam, follow your doctor's instructions carefully. Never stop taking it abruptly, as it can cause withdrawal symptoms, including seizures. Tapering off under medical supervision is crucial. For those looking for natural alternatives to benzodiazepines, several nutritional supplements might help. These include things like magnesium, valerian root, passion flower, and omega-3 fatty acids. These supplements can promote relaxation and reduce anxiety naturally. Always consult with a healthcare provider before starting any new supplement regimen. Another thing that I want to make quite clear is I'm a big proponent of using coping mechanisms to deal with anxiety. Seizures are a little different, and you really do need to get them under control. But if you're suffering from anxiety, before you jump to a drug like clonazepam, try to learn coping skills, deep breathing, the tapping method, guided imagery, yoga, tai chi, listening to music, dancing. All of these different things can really help you with your anxiety level. And there's going to be a time in your life where the drugs aren't going to work anyway. So it's good to have some of these coping skills in your back pocket. Another thing that I want to stress is you must practice these coping skills. I had very bad anxiety and panic attacks when I was in pharmacy school, and I learned over the years to calm myself down simply by using techniques that took my mind off of what was happening in my body. And I know this doesn't work for everybody, but you owe it to yourself to at least give it a try. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit that notification bell for more informative content. My name is Pharmacist Michael. Be happy and be healthy.